Sadly, MS is a disabling disease that affects the young. I have spent 25 years alongside my colleagues trying to develop treatments to improve patients' lives. In MS, we have over 12 different disease-modifying therapies now available. And while these have proven effective for many patients, unfortunately many patients still go on to experience disease activity and accumulation of disability. There's gathering evidence that HSCT may be the most effective disease-modifying therapy available. The studies have shown up to 2/3 of patients have remained stable or even improved over a 3-year period. HSCT should be considered in patients who have tried other DMTs without complete stability, or even patients with aggressive disease that might benefit from a highly effective therapy such as HSCT. It has to be recognised that HSCT is an intense treatment, and therefore patients have to be selected for those who benefit most from it and also be able to tolerate it. We have a set of guidelines to select those patients most appropriate. Those would be patients who obviously have a confirmed diagnosis of MS, and if you're relapsing or remitting, you have to fulfill the McDonald criteria. But in particular, if you're primary progressive, you also need to have a lumbar puncture with oligoclonal bands, which shows a chronic inflammatory process. We'd also suggest that patients are probably suitable between the ages of 18 and 65, and also that the disease duration should be no more than 15 years, as it's suggested that the earlier you treat with HSCT, the greater benefit you have. Another important guideline is that patients should be ambulatory, and that means walking freely on their own or with a stick, but at least walking 20 metres with bilateral assistance such as crutches or 2 sticks. At London Bridge Hospital, we like to consider each patient on a case-by-case basis. And if we feel the patients are likely to benefit from this therapy, we will present them to the London HSCT panel. And this panel is there to identify those patients who are really going to benefit the most from this highly effective therapy. Personally, my experience is that it's transformative, and it can really change patients' lives for the better.